So at Triple Care Farm, we use Dialectical Behaviour Therapy, or DBT for short. It's an evidence-based therapy model for substance use disorders as well as a number of mental health disorders. And it also has an evidence base with young people. So at Triple Care Farm, we've really evolved the way that we use DBT to work with young people, and through a little bit of trial and error, and also using some tried and tested treatment tools from other treatment modalities, so motivational interviewing, cognitive behaviour therapy, art therapy even. We've sort of come up with a mix that seems to work for the young people who present here in the program. Some of the components that we've updated over the last year in particular include using some of those art therapy and outdoor activities to increase learning. We do role plays with young people around communication skills. We use visual aspects to deepen understanding. And we use a lot of practical mindfulness activities. So traditionally, people may use mindfulness in meditation practices, but we also encourage young people to use mindfulness in a really a way that's accessible day to day. So practicing being in the moment when you're doing the washing up, or practicing being in the moment when you're having a conversation with someone. We would even use games, so we play celebrity heads sometimes to illustrate and to get young people using some of the what and how skills of mindfulness, so participating 110%, being in the moment, being non-judgmental about their answers and the answers that other young people are giving. So we try to make it fun. All of our staff at Triple Care Farm have some training in DBT, so we have a very diverse team. We have trainers, we have youth workers, we have different case managers and different specific roles, so sport and rec workers as well. And we try to have all of the staff have a pretty consolidated understanding of DBT. So young people are in formal DBT groups of a morning during the week, every second day. But when they're doing other aspects of the program, whether it's learning to cook or it's doing a budgeting workbook, we have some skills coaching coming from their trainer. And we also have some of our trainers co-facilitate the groups from time to time, so that really it illustrates to young people that it's not just for a clinical setting, that these are skills that can be used by anyone in any situation. We also have team consults, so part of the traditional DBT model is looking after the professionals who are delivering DBT. So we meet within the clinical team, and then we also have progress meetings with the wider team weekly to make sure that staff have an opportunity to consult with colleagues around their treatment plan, and to also make sure that they're able to discuss any problems and problem solve for treatment planning in the future.